Chair of the Maine Women's Health Campaign. I want to start by thanking our host and sponsors for today's celebration. First, the Patrick Dempsey Center for Cancer, Hope, and Healing, Central Maine Medical Center, Consumers for Affordable Health Care, the Maine Women's Health Campaign, and the National Women's Law Center. I'm so excited to be here with all of you to celebrate the second anniversary of the Affordable Care Act, and to be joined by our U.S. Surgeon General, Dr. Regina Benjamin. Our goal in gathering today is to highlight the many ways that the Affordable Care Act, the new health care reform law, is improving the lives of women and their families in Maine. We are thrilled to have Dr. Benjamin here in Maine for this important discussion. Dr. Benjamin is the 18th Surgeon General of the United States. As America's doctor, she provides the public with the best scientific information available on how to improve how to improve Americans' health and the health of the nation. Please join me in giving Dr. Benjamin a warm welcome.
Can you hear me? I need to pull this closer. I have kind of a soft voice. I think I'll pull it closer. Or is it on? It's on. It's on. Just move. If you can't hear me, just say so. I'll try to speak up some more. But good afternoon, and thank you for coming out. And it's really good to see so many of you who are committed to health and wellness. You know, New England is on average one of the healthiest corners of our nation when it comes to healthcare and healthcare statistics. According to the 2011 health rankings, Maine ranked 8th. And a couple of people had asked me, have I been to Maine before? And I have, because I was part of the Dartmouth co-op. And so my office and my little clinic in Viola Battery, Alabama, was part of Dartmouth co-op. So we were the only people outside of New England. So it was the only time I would get to see snow. So I was a little disappointed today I didn't get to see snow, but you have some beautiful weather today. You know, it's not only fitting because of those statistics that we're here to talk about with some individuals who've really directly been impacted by the changes that's occurred since President Obama signed the historic legislation that will eventually give all Americans access to affordable care. You know, the Affordable Care Act has some common sense rules, which ensures that you and your family's coverage will be there when you need it. It also removes the insurance barriers between you and your doctor, giving you the freedom to choose your doctor and to take charge of your own health. This means that people with chronic diseases and pre-existing conditions will no longer be at the mercy of insurance companies. Women in particular cannot be refused coverage because they are women, or their gender, or because they've had a previous C-section, or been a victim of a domestic violence. This law will give 29 million Americans peace of mind that they will not be denied coverage due to pre-existing conditions, and that they won't be dropped from their insurance if they get sick. Now, prevention is the foundation of our public health system, and prevention is the foundation of my work as Surgeon General. I've been so excited about the prevention benefits in the Affordable Care Act. Particularly, the health insurance plans are now required to cover recommended preventive services such as blood pressure, diabetes, and cholesterol tests. Many of the cancer screenings, including mammograms and colonoscopies. Counseling such as topics like quitting smoking, losing weight, recognizing and treating depression, and reducing alcohol use. Also required to cover routine vaccinations and flu shots and well child visits. But just as important, this health reform law now prevents new insurance companies from charging a copay for those very preventive services. This is really important. I'm here in a facility that you know, as a family physician, I've seen too often patients putting off getting preventive care, even if they do have insurance, because they simply didn't have a copay. I've been a long-term champion of the power of prevention, because health doesn't occur just here in the hospital or in the doctor's office only. It occurs where we live, where we learn, where we work, where we play, and where we pray. I believe that prevention offers the greatest opportunity to improve the health of America's families now and for decades to come. I also believe that prevention is the key to building a stronger and more sustainable healthcare system. And prevention is not new to the national dialogue. However, in the recent years, it's become more vital and more relevant than ever before. It's become an imperative. And that's largely due to the changing dynamics and the demographics as more American families deal and struggle with the chronic diseases like diabetes and hypertension, and the tragic toll that they take, both personally and financially. And the case for focusing more of the nation's attention and resources on prevention is more than a theory. It's a reality that's grounded in science and in experience. We know that with better health care, or with better health, children attend school more regularly and are better able to learn. And with better health, adults are more productive and at work more days. And with better health, seniors can maintain their independence. On the other hand, we also know that the lack of prevention takes a devastating toll on the patients and their families, their companies, their communities, and their workplaces. And much of the illness and the early death that's related to chronic diseases, like diabetes, is caused by just 4 simple preventable health risk behaviors: lack of physical activity, poor nutrition, tobacco use, and excessive alcohol consumption. Almost 50% of the adults have at least one chronic condition. And this year, in 2012, more than 800,000 Americans will die from heart disease. And the overall cost resulting from cardiovascular disease is estimated to be $444 billion per year. And there's so many more statistics that tell the same story. We have to make prevention part of our everyday lives and empower people to make better choices. I'm really pleased that the Obama administration has launched a broad agenda to help Americans get healthy, live longer, stay well, and to thrive. As Surgeon General, I have the privilege of chairing the National Prevention, Health Promotion, and Public Health Council. And that was established by the Health Reform Law. And this council consists of 17 cabinet-level heads of agencies like the Department of Health, Department of Transportation, Agriculture, Labor, Housing, Defense, and others, all come together to just talk about prevention. And this past summer, we released the first ever National Prevention Strategy. And our vision is to move our healthcare system from a focus on sickness and disease to a focus on wellness and prevention. Because if we truly want to reform health in this country, we have to prevent people from getting sick in the first place, to stop the illness and stop the disease before it ever starts. So in addition to the state-of-the-art medicine that we have and need to maintain, we need a new approach to promoting prevention in our communities, since staying healthy depends on other factors that influence our health, like housing and transportation, education, the availability of quality, affordable food, our workplaces, and our environment. We really want to change the way we think about health in this country, and that calls for the nation to take a more holistic and integrated approach to community health. Everything from safe highways to worksite wellness programs to clean air and healthy foods. We want to get to a place where everyone understands that almost everything that we do, even though it's not labeled as health or prevention, it really does affect the health, the quality, and the length of life of all Americans. And this health reform law is allowing us to begin to make that happen. And here in Maine, Maine has received $10 million in grants from the Prevention and Public Health Fund. And Maine has been working really closely with us to help us implement that new national prevention strategy. And there's some other statistics that I have here specific to Maine from the Affordable Care Act or the Health Reform Law. The funding for the community health centers has increased the funding that's available to 138 community health centers here in Maine. And there's been an increase of $16 million to create new centers right here. Maine has also received a $1.5 million for personal and home care aid to state training program to train more home health workers and direct care workforce. Also $600,000 to support teaching health centers in order to increase the residency programs and to have that community-based learning in the community health centers for our residents and our nursing students. As well as $1 million for the expansion of the physician assistant training program as well, to increase our workforce, our primary care workforce. In a rural state like this, you really need more primary care workers. $2.9 million to help Maine reduce the healthcare fraud. We have this entire program to decrease the healthcare fraud throughout the country, and Maine has received $2.9 million for that. $1.4 million for school-based health centers, because we need to expand and provide more health services and screenings for students. And where is a better place to do it than right in the school itself? There's several more of these. There's the $191,000 to family-to-family health information centers to organize and run by families with children and special needs, special healthcare needs. But basically what I wanted to come today to say is that with all of this investment, President Obama, the healthcare reform law, has given an opportunity for us to make our health system work better and to work easier. And the reason I came here today is that I could hear from patients, from individuals, moms, grandmas, to tell me what it means to you. Is all of this investment working? And I was told that we have a few people here right here in Maine who's going to tell me their stories so that I can take them back. So I'm looking forward to hearing your stories and what this means to you. Thank you.
Next, we're going to hear from Rachel Sukeforth, who will talk about her experience getting onto her parents' health plan.
So my name is Rachel Sukeforth, and I grew up in Litchfield. I currently live there still with my folks. I'll be 27 in April, which means that last April I turned 26 and was ineligible for taking advantage of the Affordable Care Act. But in July 1st of 2010, I was able to go back to my mother's health care insurance. Her employer does provide health insurance, and actually did up until the time I graduated from college. So I've gone through 3 or 4 years without health insurance, and in that time I did have sort of an odd incident. I was burned severely in my thigh area, and had kind of an overnight stay at the hospital. And before that, I was sort of surprised that I would ever think that I could need an accident like that. I always expected, oh, maybe, but not exactly expected, but I figured the worst case scenario, I'd get into a car accident, and my car insurance took care of it. I'm not an extreme sports kind of person, so I didn't really worry about it. So after taking care of that, I was sort of like, all right, like looking for jobs, and I've waited tables. I actually worked in a doctor's office and did not have health insurance. So luckily for me, I was able to go back to my mom's insurance. And then this time last year, right before I lost my insurance, I went to my annual pap smear, and it came back abnormal. And that's something that was obviously surprising and shocking. Okay, let's go for a colposcopy now, and having a bone biopsy. And the doctor was like, you know what, we're not going to take these risks. We're actually going to take a layer off of your cervix. And I've since gone for my 6-month exam, and again, the doctor's like, well, we're a little nervous about it, blah, blah. So I'm to the point where I need to schedule my yearly follow-up and can't actually afford it because my current job does not provide health insurance. I'm ineligible for the Affordable Care Act until 2014. Hopefully we set these exchanges up, and it'll be easier and cheaper for me. You know, I don't make a lot of money at my job. I have a car payment. I have my student loans to pay. And so I'm just thankful that I did have a chance to sort of get a baseline for where I need to be. It's been a number of years since I've been to the doctor. The doctor told me I was actually doing very well. I had health insurance growing up, so those preventive services that we talk about and good habits and patterns have been developed, and I exercise regularly. And I drink in moderation. I don't smoke. I think I eat pretty healthy. I do like my chocolate candy. But, so I think that, the important thing is it is prevention. And I'm thankful that I've had good role models and good steps to help me build those healthy habits. And I look forward to the day when I do have health insurance again, or that we can create quality, affordable, accessible health care for folks like me who can't necessarily afford a regular doctor's visit. So thank you very much.
Next we will hear from Carlene Sperry, a cancer survivor and advocate.
Well, I had cheat notes.
I do too.
You did? Okay, good. I can't wing it. First, I want to thank Hillary Schneider from the ACS for giving me the opportunity to be here today and to share a little bit of my story and concerns. I'm no stranger to cancer. I have a personal agenda and dislike towards this illness and what it does to an individual who is diagnosed with it. January 2003, 9 years ago, this past January, I was diagnosed with stage 3 breast cancer. To be exact, ductal invasive carcinoma were the words that were uttered. My annual mammogram screening detected an abnormality in my left breast. From one annual mammogram to the next, stage 3 breast cancer. Life-changing news. Detection, diagnosis, mastectomy, reconstruction, treatments, and more surgery. This could be devastating to a cancer patient who has no health care coverage, or health care coverage that does not provide access to cancer screenings like mammograms, and quality diagnostic tests and treatments, which is critical in the fight against breast cancer. My passion for today's event has immeasurable depth. Never in my lifetime did I think that I would be diagnosed with a life-threatening illness. Today, I'm more aware of the importance of early detection of breast cancer screening through mammograms, ultrasounds, and breast biopsies. Without this screening and diagnostic test, I would not be standing here before you today. If I only relied on my monthly self-examinations due to no insurance or lack of it, it would have been up to 3 years before I felt a sign of a lump in my left breast. My cancer was 1.1 centimeter in size. Damage had been done. Breast cancer invaded the breast tissue and nodes. But my annual mammogram saved my life. I'm extremely fortunate. I have had adequate health care during my illness. Yes, we had an excessive amount of out-of-pocket costs, but in reality, I cannot fathom paying any more than we did. Without the insurance coverage we have, I could not even begin to imagine the financial burden this would have cost my husband and me. Cancer patients need not fight for adequate insurance coverage while fighting cancer. Makes no sense. Fighting on a verbal level is mentally exhausting, and when the mind is exhausted, it affects the physical well-being of a cancer patient. Energy fighting for your health care is energy needed to fight the disease. Today I'm addressing the vital importance of the best health care coverage and breast care prevention, detection, and treatment for all who don't have it and can't afford it. The importance of the Affordable Care Act is to continue saving lives. It has already proved itself by improving the quality and cost of health care for people with cancer and those at risk for cancer. Also, people with private health insurance and all people with Medicare now have access to preventive services and cancer screenings with no cost, no copays, and other out-of-pocket costs. Cancer patients who do not have adequate health insurance for cancer screening and treatments do not make out as well. Later stage detection means more intensive, aggressive treatment, lowering the likelihood of survival. We need to step up to the plate and give everyone the best chance possible to fight and beat this ugly disease. Everyone deserves the best health care possible. Because of the Affordable Care Act, cancer patients don't have to worry about facing lifetime limits on insurance coverage or having their coverage canceled because they get sick. This is why it is so important for people to learn more about the law. When we educate ourselves, we become more aware on how much it already has helped people and will continue to even do so. We need to advocate the Affordable Care Act to protect our family, friends, and loved ones. Thank you for allowing me to share a little of my experience as a breast cancer patient and the importance of prevention and early detection. It saves lives.
Our last story will be from a provider, Dr. Ned Claxton, who's a physician here at Central Maine Medical Center.
We just got relocated, for those of you who think we're in Central Maine Medical Center.
I'm sorry, I grew up in the Bangor area.
My name is Ned Claxton, and some of you know me as somebody who's been a family physician in this community for 34 years. I've had the privilege of working in a private practice for about 22 years, and for the last 12 I've been working at the residency. During that whole time, I've been the beneficiary of some amazing insurance, and so I've not had to struggle with some of the issues that many of my patients have, but I have certainly seen it day after day, every day in the clinic, the struggles that individuals have had. I've also been closer to it than I wanted to be when my son had a brief lapse between college and working, when he became the beneficiary of the ACA's provision that he could stay insured until he was 26, for his 26th birthday. So a period of time he would have been uninsured. To buy insurance for him would have been very expensive for me and prohibitive for many people. So I'm personally grateful as a parent that that was an opportunity that was afforded to not have one more person uninsured and then needed to be insured. The other thing that's quite gratifying about my current work is I get to partner with so many people who are committed to using what we can about prevention to make a difference. And so right now, with an administrative team that supports our computer utilization, an IT team who understands how we're trying to pull data, we've been able to start a program we call Saving Lives Initiative. And in the last 2 years, we've been able to go back through our years of electronic records and begin to identify people at high risk for significant illness. And out of the 1,000 people we identified at high risk for abdominal aneurysm, we identified 12 who needed surgery urgently. People whose aneurysms were of such a size that they were likely to burst, and that's usually considered a life-ending event in the vast majority of cases. We're following another 50 or 60 people very closely who are high risk because we were able to go back into those records because we were oriented towards prevention. That same work is being done now in cervical cancer. We're not as far along with that, but we have had some success in the arena of breast cancer. And we've surveyed, we've identified 3,500 plus people who were due for mammograms, who for one reason or another weren't in to get them done. And out of that group, we identified 7 with frank cancer, another 7 who may have cancer, and another 40 that we're continuing to try and stratify as to their risk. They're called Cat 0, and we haven't sorted out their circumstances. So there are a lot of people who, if we hadn't been oriented towards prevention, would have been walking around with that disease unknown to them. A terrible circumstance. And then the other piece we've had some amazing success with is trying to find those who haven't had the colonoscopies that they need. And of the 1,500 people we've surveyed so far, we've found over 500 people with precancerous lesions. That's not 500 lesions in multiple, it's 500 people who have had at least one. And those people's lives have been changed, even though, because they went through that procedure. We also found 12 cancers, unbeknown to the individual. So that kind of prevention work is only going to expand with the expansion of the benefits of the ACA. And the people that we'll be able to reach out to, the people that we'll be able to touch, the lives that we'll be able to continue to help prolong, sustain, and help them avoid some of the perils that you've heard about as a patient with cancer, makes this kind of work very gratifying. And I'm delighted to be able to build on some of our work as we continually try to expand it, given what the provisions of the ACA will allow us to do. So this is my opportunity as a dad, as a family doc, and as a physician who's seen way too many people with way too many preventable diseases to appreciate what the Affordable Care Act has been able to do for all of us. Thank you.
We have time for a few questions. If anyone in the audience would like to ask Dr. Benjamin or other members of the panel a question. Yes.
Good afternoon, Dr. Benjamin. Joel Case, past president of the Maine Osteopathic Association, an emergency physician at Maine General Medical Center, between here and Bangor. When you and I saw each other about 11 days ago at a reception in Washington, I extended an invitation for you to come to Maine. Boy, was I surprised this morning. I was on my way home from working an overnight shift and had to make a call to see if I heard it right. So first of all, thank you so much for coming and bringing your message of prevention to Maine. You may not know that your timing has been wonderful in that we have been struggling in the last several months with the legislature's budget in a number of arenas, but specifically in the arena of prevention dollars. Maine has traditionally been one of the states that has held its tobacco settlement monies in providing prevention and health care and not building bridges or other uses. This fall, I was asked to be part of a commission that looked at the allocation of those funds in terms of how we should continue to spend our money. And we had a unanimous bipartisan decision to move forward with keeping our funding where it should be in prevention. That report came out December 7th. The ink was literally not dry on the report when the governor's supplemental budget came out, slashing that budget, unfortunately. And we all understand how we have to be more responsible about how we spend our money. But your visit today, I think, really illustrates a point that's really important for our state. Because as you said, we've ranked number 8. And one of the reasons we've ranked so high in the health of our citizens is that we know prevention is paramount. So while, like you, I'm trained as a family physician and I'm a public health expert, unlike you, I don't have Mr. Obama's attention in terms of really suggesting how we should focus our attention on prevention. So I really thank you for being able to do that and being able to bring your message to communities like ours. One of the things that we have done in Maine as providers, the physician leadership of the state has gotten together to create a health policy study group so that we can look at having more impact from the provider side and how we can get the attention of our legislators. So again, your presence here makes that possible. I think we've got their attention. So thank you.
Thank you for that. And you know, I'm sure from what I said, you can't get anything other idea that I am very much pro-prevention. But President Obama actually, you have his ear, and that's why we're here, because there's some of my colleagues in other communities and places that he really wants to know what you think and whether, how this is working for you, the individuals in your communities. information that we give, we try to give good information for the states. It's going to be up to the states how they spend their money. As many of you know, as Surgeon General, tobacco and smoking is a big issue for me. We just released a Surgeon General's report on tobacco on young people, youth and young people. Youth is 18 and under, and young people is 18 to 25. Because it's illegal to advertise to young people, but it's not to the other group. And 90% of people who smoke say they started smoking before they were age 18. So we give you the information. We want to give you as tools. The things we're doing with the Affordable Care Act is to give you the information, the tools, so that you as a state and as communities can make good decisions, and we're here to help you do that. I really like the fact that you mentioned about health IT. The Affordable Care Act has made it possible to help hospitals and physicians' offices, clinicians, to start to use health IT. 3 years ago, before this, less than 10% of doctors' offices had electronic health records. We're going to triple that, just because we gave some incentives to start to use health IT, bringing better quality to those practices. And after this, I can tell you how I was in practice family, solo practice for 23 years, and a couple of hurricanes made us know how important having an electronic record is. So, but that really will change the quality of care for every American, and the hospitals have their incentives too. So thank you.
Any other questions? Yes.
Dr. Benjamin, thank you also for me. I'm benefits manager here at Central Maine Medical Center, and first I feel the need to brag about 3 things, which is I've been here 32 years. We've never excluded pre-existing conditions here on our medical plan. Second, about 3.5 years ago, we amended our plan to cover wellness visits with no copay. We also we pay for the well visits, but the issue that the question I haven't been able to find. And last year, a year and a half ago, we changed to allow kids to stay on their parents' plans till they were 26. My question comes, if my 25-year-old daughter is on my plan and has a baby, to my understanding and my way, what I've been able to research, that baby would have no insurance. My daughter wouldn't be able to pick the baby up because she's not the contract holder. As grandparent, I'm not able to pick the baby up because I'm the grandparent. So just wondering if there's anything on the national level as far as coverage for the newborns, if you know of that.
Yes, we have of course, Medicaid for that, as well as the S-chip. And so S-chip should be able to pick in. Your state child health insurance programs should be able to pick the baby up at some point in time if the baby doesn't qualify for Medicaid for some reason, income levels or whatever. S-chip is there for that.
Okay. Thank you.
Okay, thank you everyone. And just to wrap things up, I'd like to invite Peter Chalk, who's the CEO and President of Central Maine Central Maine Healthcare System.
Chuck, can we get her a shirt or something? Well, thank you, Dr. Benjamin. It's a real pleasure to welcome you to our state, to Central Maine Healthcare. I don't think we've ever had the Surgeon General in our institution, so in fact it is a real honor. Have you heard briefly from several of the speakers, and Jerry as well? As an organization, we believe we've done a great deal in prevention. We take it very seriously. Our Saving Lives campaign has been an unbelievable success. Our other wellness initiatives, our work in our heart program and our cancer program, the work with our Dempsey Center, and the work we've done in our electronic medical record now for about 12, 14 years. We were very early adopters in that. So we're very serious about our work, and from my standpoint as a CEO, I've had many examples over the years where Ned talked about numbers, and in a small community like this, oftentimes those numbers translate to a person that you know, that person that you've talked to, and when you really personalize it, it takes on a whole different perspective. And we've been fortunate, I've been very fortunate to see some of the people that have been impacted by our programs, and essentially their lives have been spared. We also recognize that this is a major transition for us, and for people running healthcare systems. You get a lot of gray hair transitioning from a sick care system, which is traditionally what the American system was, to a well care system. But we believe that we've done a lot. We've done a lot with our workforce, we've done a lot with employers in this community, and we're very willing to take the next step. In fact, this week we'll be submitting our application to become an ACO under the Affordable Care Act. We anticipate that that will cover thousands and thousands of Medicare recipients within our community. We believe a lot of the things that we have done will work well in managing that population. We also recognize that we still have a lot to learn, but we think we can learn by doing rather than studying it any longer. So we'll be putting that application in. We hope, working with the federal government, that even though there's pages and pages of regulation, I hope all the ACOs that are in place will have some flexibility, that we can learn from each other, and that we can take this journey together. Because clearly, we have to improve the health status of our country, and we cannot solve this problem by just taking care of sick people. So I want to thank you for all your efforts, the administration's effort to support this, and we're very willing to take this journey with you. Thank you.
Thank you. And I just wanted to say, when I walked in, I came in about 15 minutes ago, so we went into the gym or the fitness center. It's very well done. It's a very nice facility, and it's being used. Usually you'll see them, but they're in the middle of the day. It's really being used, and that reflects on the numbers that we see. You didn't get to be ranked number 8. I'm from Alabama. We're in the low 40s, not low 40s, high 40s. We're not 50, but we're in the high 40s. So to get there means you've been working at this for a while, and you know, I really appreciate what you do and want to say, commend you for it, and also say that there's still work to do. There's a lot of work to do. We want to make sure that you have the tools, whatever you need to help, to inspire you. There's a number of programs that I'd like to talk to you about that we're doing in the Surgeon General's office. One in particular is my Journey to Joy. That is, that we should make health care fun, that it should be enjoyable. We've taken the joy out of health. It's not joyful for the individual anymore. It's not joyful for the doctors or the clinicians or the, anyway, we need to put that joy back into it, that it's so important that you enjoy it. When you talk about exercising, you think, oh, what a dread. It doesn't have to be dreadful. It can be fun. When you talk about what you're eating, it doesn't have to taste bad. It can taste, healthy food can taste good. And you just enjoy what you're doing. You can dance, you can play. You don't have to, be on a treadmill all the time. Just have a good time and make being healthy enjoyable as part of our culture. And so you're well on your way to do that. So thank you very much, and thank you for your hospitality. And we'll be here for a while, so some of you are shy and don't want to ask questions publicly. I'll hopefully can meet you and talk to you.
Okay.